When a home or building is engulfed in flames, the firemen douse the building with water and fire retardants. Once the fire is extinguished, they want to know the cause. Unlike the medical profession that treats the sickness, the fire department looks to treat the cause. The majority of the time, the fire could have been prevented, as could many health crises.
You may not know it, but there is a fire going on inside you. It's called inflammation, and it's the #1 cause for heart disease.
And what you don't realize is it's smoldering inside your body.
Never giving us any signs of the lurking dangers until disaster strikes and the ambulance sirens scream.
What you'll learn in the next 12 minutes will be invaluable.
What you're going to hear is not fiction or hype, it's scientific fact.
Every 34 seconds, a person in this country dies of a heart attack. By the time you finish watching this life-saving video, 22 people will have died from a heart-related disease. 2,500 people die each day of a heart attack. The American Heart Association reported in 2006 that 71 million people in the United States have cardiovascular disease, and 13 million more have coronary artery disease. In 2007, 1.5 million men and women will die. That means that there's a very good chance that it will kill you too. This video is more powerful than Dead Doctors Don't Lie. You're going to have the opportunity to have a conversation with Dr. Dwight Lundell, a world-renowned heart surgeon who has just written the bestseller, The Cure for Heart Disease, in which he politely proclaims, heart disease can be cured. Dr. Lundell knows of what he speaks, for he's performed over 5,000 heart operations. He was one of the first surgeons to operate on a beating heart. His peers agree that he helped to shape cardiovascular medicine.
Today, you're going to learn how to become a personal trainer for your heart using all natural products. Dr. Lundell always felt that he could save more lives if he just treated the cause instead of just fixing the problem.
There I was in the midst of surgery, looking at a patient and thinking, this man shouldn't be lying on the table. He didn't have the typical risk factors for heart disease. His cholesterol was in check, he wasn't obese, he didn't smoke, yet he did have that one condition that was present in each and every patient I ever treated, which was inflammation.
It didn't sit right with Dr. Lundell that half the patients who suffered a heart attack actually had normal cholesterol. His passion for saving lives led him to question the general medical belief that inflammation was just a side effect. He concluded inflammation was the true culprit. The Physicians' Health Study demonstrated a 44% reduction in heart attacks by taking an aspirin a day.
Why would an aspirin result in such a great risk reduction? Simple. It's an anti-inflammatory. On the other hand, the study concluded reducing intake of cholesterol has no effect on the risk of chronic heart disease.
Last year, Americans were so paranoid about cholesterol, they spent $117 billion for cholesterol testing alone. And it did not add 10 seconds to their life expectancy.
Last year, the sales of Lipitor, the statin made by Pfizer, reached $12.5 billion. That's billion, making it the largest selling drug in the world.
Statins do not lower mortality rates in men who have not been diagnosed with heart disease. And statins do not reduce mortality or heart attack in women. It's a big business.
Are you aware that cardiovascular disease is the single greatest health threat for women today? That's right. It kills more women than breast cancer and all other cancers combined.
When would you like to have a conversation with Dr. Dwight Lundell? When you're on a gurney or now, in the privacy of your home? The answer is obvious.
Hi, I'm Derek Partridge, and I'm here with Dr. Dwight Lundell. Doctor, in your best-selling book, The Cure for Heart Disease, you say that the common denominator cause for heart attacks is inflammation. Now, if the reduction of inflammation can prolong your life, prevent illness, and alleviate pain, why hasn't the medical profession already told us about this?
The answer is simple. It's big business. You can't turn on the television without seeing an ad for Lipitor or Crestor. It's a victory of a $30 billion drug industry over your good health. The reason I wrote the book is to bring attention to the fact that the root culprit for heart attacks is not cholesterol, it's inflammation. Do you realize that over 1/2 of all heart attacks occur in people with normal cholesterol level? If a theory is wrong half the time, why would any scientific mind continue to preach it when it fails 50% of the time?
You are very passionately positive that inflammation is the cause of heart disease. What makes you so sure?
In 25 years of performing heart surgery, there was one condition that was always present in each and every patient I ever treated. That was inflammation. My research isn't theoretical, it's hands-on. For more than 5,000 times, I've held that ugly disease in my hand. It was red and it was inflamed. Dead patients don't lie.
Dead patients don't lie. Isn't that the truth? But what about all the good doctors who continue to prescribe statin drugs and still insist that we lower our cholesterol?
They're doing what they're trained to do. Match a disease to a medication and write a prescription. It's the standard of practice in America and Europe. The cholesterol heart disease theory is so ingrained, it's no longer science, it's dogma.
Well, that's really flying in the face of popular belief. Okay, let me ask you, from my standpoint, the idea of fatty junk in my blood gradually plugging my arteries does seem to make sense.
It did for a long time, until we learned that our arteries are different than the plumbing in our house. Our arteries are not static pipes. They're living tissues that regulate blood flow, respond to stimuli, and respond to injury.